Hello, this is Dr. Divakar Bhat, Cardiothoracic and Vascular Surgeon working at Aster RV Hospital, JP Nagar, Bangalore. Today I'll be talking about valve replacement operations and which valve to be used. There are two options, metal valve and tissue valve. Today I'm not going to talk about the repair of the valve, that is totally a different entity. When a surgeon and experts decide about the valve replacements, that means for this valve there is no other option, it has to come out and artificial valve has to go in. That is when we call it as a judgment or decision for valve replacement. Then when this decision is taken, the next dilemma to the patients and attenders is always which valve to be chosen, metal valve or tissue valve. This is very commonly asked questions and we spend a lot of time in explaining the advantages and disadvantages of each valve. But still many people get confused and they tell doctor, you decide and put me the best valve. But it is better to know the advantages and disadvantages of each valve so that you will know how to live with that new valve. See, these are all metal valves and this is a tissue valve. And as I told in the beginning, the valve is nothing but a structure in between two chambers which directs the blood flow in one direction, and when it gets diseased, it can either get stenosed or leaking. And a surgeon and cardiologist and experts would have decided there is no other options left out like medicines or angioplasty or ballooning. The decision has been taken for valve replacement. So now I will tell which valve to choose depending on your disease and depending on your patient characteristics. First thing comes to our mind is age of the patient. If the age of the patient is less than 60 years, the standard recommendation is go for a metal valve. And if you are above 60 years, standard recommendation is go for a tissue valve. I'll tell the reasons why. Then the next entity to be discussed is longevity of the valve. Every patient will ask me, sir, how long this the artificial valve will function. Definitely these metal valves, if you take care of this valve properly, if you take doctor's advice, do a regular blood test and take blood thinners properly, these metal valves works forever, lifelong. Whereas this tissue valve, the longevity is limited. So far recorded is 15 to 20 years maximum. Some valves might fail in 10 years only. But there are some advantages. I will explain why some people we recommend tissue valve. Then other common thing many patients tells me is valve click. When we put a metal valve inside your heart, you can hear a valve click because it's a metal. This one, you can hear a click like this. It is something like a watch sound when you hear when you are sleeping alone and when the surrounding is noiseless. You can hear the watch click. The same way the valve click is heard, and some patients don't like this. Whereas this disadvantage is not there in the tissue valve. Then another entity, not so important, but for many patients important is cost of the valve, how much each valve costs. Normally these metal valves are slightly cheaper than the tissue valve. Metal valves are cheaper, and even now we have Indian made, this is called TTK Chitra valve, excellent valve I have been using for last 20-30 years, excellent result. These are all imported valves. Not much difference, but one need to know. But in general, the metal valves are lesser than the tissue valve, cost-wise if you discuss. Then the medicine usage. When we put a metal valve, you have to take anticoagulation, that is called blood thinners or blood clot formation. See, this being an artificial thing inside your heart. Whenever blood comes in touch with this, the blood can become clotted and it can throw emboli or stroke inside your body. To avoid that, we need to keep your blood thin. For that, you need to take acetron. So that disadvantage is not there with the tissue valve. Tissue valve, we need not take any tablet. That's why many people opt for this, especially elderly people. When you have this metal valve, you have to take blood thinner, and how much to take the blood thinner will be decided by blood test. So that is another disadvantage. You need to undergo regular blood test, report to your doctor, and slowly you only will get to know how much to take, whether to take 2 milligram, 3 milligram, or one should not forget, that is very important. You should not take too much tablet also, because blood can become thin and you can bleed anywhere whenever you have a shaving or whenever you brush your teeth, urination, defecation, there can be a spontaneous bleeding. So you should not take too much blood thinner also, and at the same time you should not forget also, the blood will become thick and you can throw emboli. Then in reproductive age, we try to avoid this metal valve, we try to put a tissue valve, knowingly that this patient might require a reoperation after 15 years. That is because these blood thinners have a negative impact on embryogenesis or fetal formation. So your baby can be born with several defects if you use a metal valve and if you use a blood thinner. So in such patients, we use a tissue valve. Then in sports persons wherein they want to avoid anticoagulation because during injury they can have a bleeding because of the blood thinner. So for such patient, knowingly we explain the thing that you might require a reoperation, we might put a tissue valve. So this is in general one should know, wherein we use a metal valve, in which case we use a tissue valve. Each has advantages and disadvantages. Better to understand and choose your valve. If you are still confused, you can always believe your doctor and leave the decision to your expert doctors. In Aster RV hospital, we have a team of doctors very well trained in valve repairs and valve replacements. And for a surgeon, it is technically there is no difference between putting a metal valve and tissue valve. This judgment will be invariably taken after discussion with patient, attenders, cardiologist, and concerned people. So we will help you out at Aster RV Hospital. If you have any doubt, please contact us.